Welcome to Between the Sheets, the podcast where we're going to cover a variety of topics related to sexual health and wellness. I'm Dr. Stephanie Zwonitzer, your host. I'm a nurse practitioner and have been in practice since 2017. I have my Doctor of Nursing Practice degree, and I specialize in urology and sexual health. I am so excited to explore all of the various topics related to sexual health and wellness with you in a fun, spicy, educational, and non-judgmental manner. So come on, let's get between the sheets. Hey everybody, welcome back to Between the Sheets. I am excited about today's topic for you. One of the biggest things in my life has been being healthy, and I have an amazing guest on today to talk to us about how being healthy can actually enhance our sex lives. Today's podcast guest is Sheena Rose Stelmack. She brings a wealth of knowledge and experience and insight into the field of metabolic health. Sheena began her career as a critical care nurse, caring for patients with complex medical needs in a hospital setting. Her years in critical care sparked a drive to make a difference in preventative health, as she observed that many of the chronic conditions her patients faced were preventable through better metabolic management. After earning her master's degree as a nurse practitioner, Sheena shifted her focus to weight loss and metabolic medicine, where she now works with clients to optimize their health. Currently, Sheena is integrating hormone health, seeing firsthand how metabolic health, hormones, and lifestyle factors are deeply interconnected. Her goal is to empower clients to understand the importance of metabolic health, using medications and lifestyle changes as tools for achieving lasting wellness. She's passionate about helping others cultivate a proactive approach to health that leads to long-term positive outcomes. Welcome, Sheena. Well, I work on my professional voice from time to time.
So I'm very excited to be here. We were speaking a bit beforehand. You are definitely the sexpert. This is your thing.
Yeah.
I have been focused a lot more on chronic disease, weight loss, and it has led me understanding more of how these things overlap in so many ways. Being more prepared, learning more, being able to share information with patients, helping them be more comfortable and confident in talking about both of these taboo topics, I think is an amazing combination.
Yeah, it's awesome because, you're right. They are taboo. People don't just bring up sex. I mean, sometimes with your girlfriends, you'll talk about things here or there, but not just to anybody. And certainly with weight, I mean, telling someone that they're overweight as a medical professional is almost like you're like cussing at them, or so, like it's hard to talk about that with them. So how did you kind of develop what you're doing now and like get into that?
Well, with the introduction, you talked a bit about I came from critical care. So working in critical care, I had seen most of my patients were 40s, 50s, 60s, and why they were in critical care in the hospital and needing help was a lot of chronic illness, things related to weight, things related to metabolic health. And more, I realized all the providers kind of don't talk about that part. Don't talk about when you go home, healthy things to eat, diet, exercise, things that can improve. It was more just here's your medications, good luck, good day. Also, with seeing the sensitivity, again, the taboo around weight, I think doctors are very uncomfortable with that conversation, dancing around it, not wanting to hurt the feelings of patients. Again, they feel they might be, talking down to them or attacking them in a way. So just making sure that you're confident with talking about the subject, bringing it to the patient's attention in a healthy way. We're not necessarily focused on just a number. It's more metabolic health. It's more about all of those things that interplay.
Yeah. And so you were saying that, you do this for anybody that needs weight loss. Obviously, this podcast focuses on the sexual side of things. So what about having a healthy weight? How does that impact your sexuality and your sexual health?
In so many ways. So quick overview, thinking about body image and confidence. That's a big part of sexual health. If we're not feeling good about ourselves, we're not going to want to, have sex with our partner when our confidence is low. Reproductive dysfunction. So sex health with patients that are working on starting a family with overweight and obesity that can affect things. Erectile dysfunction in men. PCOS in women. So working on decreasing weight and getting to a healthy weight can help there. A decrease in libido. We know that more adipose tissue or belly fat can lead to increased levels of estrogen in men, which then again leads to that erectile dysfunction. So all of these factors play into it.
Yeah. And I think too, from my perspective, being in urology, I don't manage their weight, but I certainly talk to them about it. And I love that there are people like you who specialize in that side of it. So I have someone to help reach out to because I can tell them they're overweight. I can tell them that losing weight will benefit them, but that's not my world to live in and to teach them how to do that. And so I love that you have this opportunity to help those patients. Talk to me about I think there's like cardiovascular benefits and hormone things that come from getting more metabolically balanced and healthy.
Absolutely. So cardiovascular health, thinking about erectile function. And so making sure your heart healthy, making sure that you have good blood flow to your organs is very important. Um, as a matter of fact, erectile dysfunction, I'm sure you know this and discuss this with your patients, is actually a first indicator or a first sign of cardiovascular health concerns. So patients realizing that the erectile dysfunction is not norm, and when that is starting to happen, or noticing that, feeling comfortable and talking to you about it or their
Mm-hmm.
primary care, and then being able to kind of look into their blood sugar levels, insulin sensitivity, blood circulation. Is there something else going on metabolically? And this is now a symptom of that.
Yeah, absolutely. And if they don't get their blood pressure under control, then they're on blood pressure medications, which also affect their blood flow and their
Absolutely.
erectile dysfunction. So it's compounding. If we can get your health better, we can get your blood pressure and your insulin and your blood sugars better. And then hopefully the erectile dysfunction improves as well. So yeah, it's huge. What about hormones? Like I know that you and I have talked about that before. So talk to me a little bit about that.
You did a great episode on the testosterone. So I encourage
Yeah.
everybody to go back a few episodes if you know it all offhand. It was really good in covering all the causes of low T. And I know that you did mention cardiovascular health
Mhm.
and weight in there. So I keep leaning on men, not to
That's
pick on
okay.
them, but when we think about the dad bod, that's been something that we've heard more and more. Almost normalizing that and thinking about what that really means, though, that fat, that adipose tissue in the abdomen. So increase of that visceral adipose tissue actually affects the hormone levels of the men. So more decrease in that testosterone, those androgen levels are affected. Higher estrogen in men than we should see are decreasing those levels of testosterone, which then lead to a decrease in sexual arousal, performance, the desire, so working on decreasing that belly fat, just by working on exercise and weight loss, we can help with erectile dysfunction before leaning on medications.
Yeah, absolutely. Now, I haven't, and I've admitted this on this podcast, I am not very well versed in the female hormone replacement
Mhm.
and things like that. Is that something that you focus on as well for perimenopause and menopausal women?
There is so much for perimenopause and menopause, and I'm constantly learning. Recently finished up my actual second certification course because
Awesome.
there is so much to know. And when I'm bringing patients in, I really want to have a great understanding.
Yeah.
So, absolutely, women, perimenopause, think about before you get to menopause, we start to have hormone changes and symptoms in perimenopause 10 years before we get to that level of menopause. So, dryness, decrease in desire, mood changes,
Hmm.
different things that are affecting our sex health. And with a boost in testosterone, whether it's injections or pellets in women, we can boost sexual desire as well and improve sexual health.
Yeah, that was one of the things that was interesting for me, even because I deal with a lot of estrogen cream topically for
Mhm.
my ladies in their vulvar area, which is a huge problem with menopause. But one thing that came out is a new product. Well, it's not super new anymore, but it was new to me. La Rosa, which actually has a little bit of androgen in it. And so for my ladies who maybe aren't quite ready to try testosterone replacement or are just maybe struggling a little bit, I've tried that and just that little bit helps. So I can only imagine if women are lower on testosterone, coming and getting that boost, how much better they would feel.
Absolutely. There's a
And then
lot that we can do.
and for increased stamina and all of those things, not just the sexual desire, but it helps a lot of other aspects of life as well.
Mhm.
Yeah.
Weight is a big factor with the perimenopause, menopause age. Women tend to gain that extra weight, a lot of times again in the belly weight and in the hip area. And I have women that are very good with their exercise and they are doing everything they can. They're eating right, they're sticking to their keto diet or their sugar-free diet. They're seeing the trainer and they just cannot push past this weight gain that they're seeing at that age. And it's devastating for a lot of women because they're working so hard. And they're seeing all these other changes, mood swings, decrease in, that sexual lifestyle with their significant other. So even with some of the hormone replacement that we have, and then also the weight loss medications that we hear of, like the semaglutide and the tirzepatide,
Mm-hmm.
with the improvements in the insulin sensitivity, it factors into helping with that hormone regulation as well. And these women feel much better and they're able to get that 5, 10, 15 pounds off that they've gained in this perimenopause stage.
That's awesome. That's so great. Now, what about mental health? Because although that's also affected by hormones and stuff, just not being in a physically healthy state also affects your mental health, correct?
Absolutely. And I'm also a psychiatric nurse practitioner as well.
Yeah.
So again, everything factors over top. So the mental health is a huge part of it. Mental health, playing into hormones. There will be times where I'll see patients that schedule with me for a mental health consultation. And once we get to talking and we're looking at age, we're looking at symptom management, we actually will lean in more to addressing things as far as diet, exercise, weight loss, and hormones and different supplements versus jumping to something like an SSRI
Yeah.
or a mental health medication.
Yeah, it's so for me personally, I've talked about it on here before, but I've given up drinking and I've tried to make myself much healthier. And I've had depression for many, many, many years. And I have been able to decrease my SSRI just because I've gotten myself in a healthier state and I'm not putting on the depressants of alcohol and fried food at the bar and staying up till 3 a.m. So it certainly has made a difference for me personally. So I know that it definitely can for others as well. What about exercise? How does that factor in? What is that going to improve for us?
Well, of course, endurance and stamina, which we all would appreciate.
Yeah. Yes. Especially with you having a grandbaby over there. You got to be able to keep up with her.
Oh my gosh, yes.
Yes.
So, cardiovascular health, of course, exercise is going to help with that. The benefits of the weight loss, improved self esteem. That is such a big one with exercise. A lot of times I see patients very similar. They'll be nervous about getting to the gym. They feel like they're overweight, so they don't belong at the gym, which is not at all the truth. The gym is the most welcoming place for people and the place
Yeah.
to work on decreasing your weight. So we see a boost in self-esteem, self-confidence, those improvements, blood sugar comes down, cholesterol levels can decrease, blood pressure improvements. And then again with that weight loss significantly affects all these factors underneath and improving that metabolic health.
Yeah, that's awesome. And I think just like you were saying, like we just feel better. And when you feel better about yourself, you're feeling more sexy and you're more open to that. And you're going to come out of the shower naked instead of all wrapped up in your towel.
Absolutely.
Yes. Yes.
If there's
What?
one thing I could help people, get started, it's that exercise routine. I feel like, yes, the medications are an absolute amazing tool, but the mental health effects, the cardiovascular effects, the strength, being able to move around in the bedroom or where else,
Yep.
that comes with being able to use your muscles and stay strong is so important.
Yeah, absolutely. I completely agree with that. So, outside of working out, what are some other things that we can do to improve our health and get ourselves sexier?
Avoid sugar 100%.
Okay.
Everyone hates when I say that, but it's true. It's true. Sugar is terrible for us. As you know, with
Yep.
decreasing and eliminating alcohol, a big factor in that is the sugar
Oh,
content
yeah.
of the alcohols that we drink. So that is one thing that's going to help with sexual health and your metabolic health is going to be eliminating that sugar. It's difficult because we think of it as a treat. We think of it as something we've earned or deserved, but it is actually just an addictive substance that they put in everything. So working on dietary, eliminating that sugar is going to be a big thing that's helpful.
Okay. Yeah. Are there other dietary things as well?
There are some foods that are good for us, sexual benefits. So foods that are rich in omega-3 fatty acids. Those are your fatty fish. Making sure you're getting whole caught, not farm raised is
Okay.
ideal. Things like chia seeds. Now that one, making sure that you're eating the right amount. Going too
Okay.
much with chia seeds and flax seeds actually can increase estrogen. So if you're somebody that
Okay.
naturally tends to be on the higher end of estrogen, you want to kind of eliminate those.
Okay.
But omega 3s doing a good supplement that helps with boosting your mood, boosting blood flow,
Mm-hmm.
cardiovascular health. Dark chocolate. I had a great grandmother who used to say to eat dark chocolate every morning first thing. And I used to just do it because that's what she told me. But it turns
Okay.
out the flavonoids in there do improve our blood flow, boost serotonin, so
Okay.
mood enhancer and enhance sexual pleasure.
Excellent.
Watermelon is nature's Viagra. I'm sure you know.
Interesting.
Have you known this?
I have not. This is great. I love it. I did not know this.
Yes. So sertraline in watermelon is an amino acid that boosts nitric oxide production, which helps,
Okay.
again, improving that blood flow
Yeah.
to the sexual organs. So adding watermelon in throughout the day is a positive for the guys.
Everybody always talks about the oysters and things like that. Why aren't we
Hmm.
talking about watermelon? This is
Yep.
great. I love
It's
it.
a good one to know, and it tastes great.
Yeah. That's awesome. Anything else food wise?
Healthy fats,
Okay.
avocados, olive oil, different minerals, vitamins, vitamin D3 for everyone. Things like magnesium are great.
Yeah.
Magnesium helps dilate the blood vessels, so increasing that blood flow. Things like spinach, those are all
Okay.
great things that you can add.
Awesome. And then how do you feel about the factor of sleep in all of this? Because I know for me, sleep is a huge factor in my overall health, my desire to go do my workout, my ability to do my workout, all that stuff.
Sleep is extremely important. I actually had the benefits of working with the sleep medicine provider in the past. Came in and gave great information on make sure your bedroom is cold. He said 65 degrees or colder, very dark, no artificial lights. So
Okay.
anything like your cell phone, make sure that it's
Yeah.
turned off so it's not lighting in the middle of the night, no TV lights on.
Okay.
Sleep health leads to improved cardiovascular health. Improved cardiovascular health can lead to improvement in sexual health and then also weight loss.
Okay. Awesome. I love all of those things. So if you have somebody that comes into you, they started their exercise program, they're trying to get good sleep hygiene. They're doing pretty good on nutrition. I mean, let's face it, we all have hiccups, but somebody's doing pretty good. You have the medicines after that? What do you do next if they're still struggling?
We do have medication as a tool. And
Okay.
just as you listed all of these things, I always go through non medication approaches first. We
Hmm.
can make some of these changes. But again, those people that have been working to make these changes and they're still struggling,
Hmm.
we absolutely can look at things like semaglutide, tirzepatide, which are our peptide medications that we have, different supplements, ashwagandha, we use different medications such as Wellbutrin so that can
Okay.
boost mood, also decreases cravings for people. So we have a lot of different things that we can try. The semaglutide and tirzepatide, I think, are important to touch on because they have
Yeah.
been all over.
Yes.
It seems like semaglutide or Ozempic, the brand name, is a cure
Yeah.
for everything. It's like, oh, you got to hang now. Get
Right.
the Ozempic.
The Ozempic. Go see Sheena and get a shot.
Absolutely. Come visit me. But it helps greatly with the weight loss.
Okay.
Increases your pancreas's ability to push out to help with better insulin. So you have
Okay.
a better baseline, a better control of your blood sugar. It triggers different things that help decrease cravings. So people call it food noise.
Okay.
So they have decrease in those cravings. So they're able to eliminate or limit that sugar.
Okay.
So it helps with the weight loss. We have good studies that are coming out that are showing that improvement in blood sugar control and that weight loss are leading to better blood flows to sexual organs, enhancing arousal and sexual performance, keeping that heart healthy. The weight loss plays into that confidence in your body, male or female, feeling more positive, leading to better sexual experiences. And then the mental support and mental health with decreasing your weight. Also, the semaglutide and the tirzepatide have been shown to boost mood, reduce anxiety, and that indirectly has a good effect on healthy sex life as well.
Yeah, absolutely. And I've also heard of Ozempic babies, like people who weren't able to get pregnant, all of a sudden things are working right.
Yes. So there's different thoughts of why that is. We've seen in patients with PCOS that insulin resistance that leads to PCOS with Ozempic, tirzepatide, that's improving those levels. So that's one factor. Again, the boost in self-confidence. So that's another factor. And decrease in overall weight and improving metabolic health. Our bodies are more ready to get pregnant and able to hold pregnancy.
Yeah, it's so cool. I mean, I know that there's downsides to the medicine too, and it's not right for everybody. But certainly for those that it is right for, it sounds like it's not necessarily a miracle drug, but a really good addition to a healthy lifestyle to improve the outcomes you're getting.
Yes. So thinking about medication as a tool always. I think about this for any medication. Anywhere from invasive surgery for weight loss versus taking, an injection once a week. They're all a tool and they all need the support of the diet and exercise. So I don't like to oversell it by saying it's a miracle, it'll do all of these things, but just saying it's a tool that we have available that we can use to help us get to a better place with our metabolic health.
Yeah. No, I think that's great. I'm even in my own practice in urology, I mean, I'm very much a proponent of natural things first. If my ladies are coming in with overactive bladder or whatever, I'm always talking about, all right, what are you eating? What are you drinking? Let's get out some of those irritants. And then if we're still not making progress, let's try medicines. Let's try pelvic floor physical therapy. Let's do all these other things that are proven to help without any negative long-term things. And so I'm always a proponent of that as well. But yeah, when medicine is needed, it's like you said, it's a tool, and it's great that we now have some really great tools that weren't there before.
Absolutely. I like having that conversation with patients about medication being a tool. I'm very excited for podcasts like yours that encourage patients to learn more, and they're coming to appointments with a lot more questions and a lot more understanding, which I absolutely love.
Yeah.
I'm one that I could talk all day to my patients, and the more questions they have and the more interested, I feel like the more success they're likely to have.
Yeah.
So being able to have better understanding, podcasts like this with more information, talking about these taboo subjects is very helpful.
Yeah, I agree. Thank you for that too. Okay, so we're working on getting healthy. We're getting healthier. Our blood pressure's getting better. We're losing weight. We're feeling sexy. How do we maintain that? How do we do this long term?
Maintenance is tricky. It's a tricky term because when we think of maintenance, we want to be, steady and stagnant with where we're at. A lot of patients get a number in their head and they come to me with a number of where they want to be. And then once they get to that number, they think they're going to maintain that. Throughout the lifespan, throughout the years, things change, situation, environment, the ability to get into the gym, the ability to meal prep, all these things are going to adjust. So we have to think there's going to be times of ups and downs. So we need to really get comfortable with thinking about our metabolic health, not as a number on the scale, but more as how we're moving, how we're feeling, how our clothes are fitting, our mood, our sleep health, like mentioned. So not hyper focused on the number, but knowing where we want to be and how we feel with our metabolic health. Medication we can use for some people will use it longer term. Some people were able to use it short term, 12 weeks, maybe longer, and then we can start to titrate off the medication and look at how we're responding. Ideally, my goal, and I spend a lot of times with patients on that supportive diet and exercise goals, lifestyle changes, and working on making those changes while using the tool so that when we start to titrate off, we're able to be in that more maintenance stage.
Yeah. No, that's fantastic. And just the more that they continue that, the better their sexual function will stay, or their erectile dysfunction will, not progress as quickly as it would have had they not been maintaining all of that and working on being healthier.
Absolutely.
Yeah, it's awesome.
And
What a
this
great
is
conversation. So tell me, do you have any specific patients that you can think of off the top of your head that kind of really exemplify what you were just talking? They've gotten their shit together. They're really doing the lifestyle, and life is just better.
Absolutely. I have one patient in particular that is a standout because I follow her on Facebook. So I get to see the different things that she's up to. So this was a lady who was actually in her 60s who came in to me, lifelong struggle with weight. When she listed out the types of diets that she tried, it was everything and anything that you could think of, things that brought back like my childhood, like Nutrisystem, Weight Watchers.
Right.
She's tried it all. So we started her on the semaglutide. She was doing her injections. And on top of that, the conversations we were having about making sure that she was doing lifestyle changes. She signed up for a gym, which she hadn't done in a very long time. We got her a watch so that she could track her steps daily. We set goals on how many gym sessions to do, and then we also started food logging, which is difficult and it's tedious, but in order to really see where you might be missing things, your protein intake, realizing those corn chips, you're actually eating 10 servings, not one serving, is really good in helping. So this patient, we did 6 months of medication. We got to where she was feeling comfortable. We started to titrate. At this point, she sees me every 2 months and we do B12 injections for her energy, but her weight has maintained within 5 to 6 pounds. And she posts on Facebook when she does a new gym routine. She'll post her steps online so that I can see how many steps she's doing. And she's just really been in this maintenance phase. And at this point, I feel like it's almost close to a year that she's been in maintenance phase. I do have some of those Ozempic babies that you mentioned. I have a couple of patients who, came into me with PCOS. They were overweight. They more were just looking for wanting to have more energy, wanting to be able to, get started at the gym and start to see changes on the scale, which with PCOS is so difficult because you have so many things working against you. So I have some Ozempic babies from the office.
I love it.
They will be coming soon. So that's exciting. And
that is great.
I've had one or two patients that have done so well, and that their husbands have noticed the improvement in their mood, improvement in their energy, and they've come in and said, I want to try this. I'm convinced I want to try it. It's helping.
That's awesome. I love that. So for the listeners, you have a health and wellness clinic and you do, I know you do like the Botox and stuff as well, but you do focus on just general, like being your best self. And that includes the weight loss stuff as well, correct?
Yes. So we do a lot. And And again, all things overlap. Mental health, Botox is one of the best things for mental health. I have to put that out there. I love it. So we do Botox and other aesthetics. I would say weight loss is my primary thing that I focus on. And now with the addition of the hormone health, because it just overlaps so much. Having the semaglutide, the tirzepatide, and being able to pair that with the hormone health is a game changer in both women and men. So that is my passion. I'm hoping to start to work more one-on-one with patients and even getting some more patient stories to share. It is having patient stories is a little more difficult because not everyone wants to share what they're doing because it is their personal business.
Yeah.
And when they've struggled with things, they don't necessarily want to share that. But I have a couple of people that are willing to share. And I think that would be great to encourage others.
Yeah.
So we do that. And then also the mental health as well.
Okay.
We're located in the Fallston area.
Of Maryland.
Of Maryland.
Yep.
So Cambiare is a difficult name. It's Italian for change. So
I love that. I wondered where that was from.
My business partner actually came up with it. It's beautiful. Cambiare. It's probably pronounced more beautiful in Italian, but I can't get it out. So Italian for change. We offer all of those services, and I work there with my business partner, Jessica.
Oh, that's awesome. So we will put in the show notes from today, I will have links to Sheena, links to her wellness center, and just ways to get in touch with her if you need someone local. Now, do you do virtual visits at all?
I do. I'm adding in virtual visits for patients as well. I like the in-person. I feel like there is something to that accountability.
Yeah.
And having my patient in front of me and no distractions. So I really do enjoy that one-on-one time with my patients, but I understand in the busy, patients are working, there's a lot going on. So being able to offer the telehealth is important as well.
Yeah, I offer it as well, but I've been cutting back because I really like the in-person as well. There's just, and you just get to have more fun with your patients too.
Yes.
Yeah.
I think important things for patients, especially if you're not able to reach me directly or I'm not in the area where you're located. So focusing on things that you can do, learning more about your own health markers, getting your lab work, talking to your primary care, requesting a fasting insulin level. That's something they tend to not add into our lab work currently, but we're learning that that is one of the best markers for metabolic health.
Okay.
Adding the exercise. Thinking even walking is an amazing start. I worked with an endocrinologist years ago who used to tell her patients, if you start with 1 minute today and you just add a minute each day, the next time we talk, you're going to be up to at least 30 minutes a day. And I thought that was an amazing way to kind of get your mind around it.
Yeah, it really is. And it makes it doable.
Absolutely. And keeping in mind that medication is a tool. It's not curative. It's a supportive thing that we have along with our lifestyle changes. This is true for any and all approaches from surgery to any supplements. This is a tool and it's going to be helpful. And I really hope that patients seek to learn more about healthy diet and exercise and start to understand that exercise, healthy lifestyle, making these good choices is just going to help in all aspects of life, from mental health to physical health to sexual health to overall well-being.
Yeah. That's awesome. Oh, I love it. I'm so glad you came on today. What a fun topic. And it was so nice to get to chat with you. And I just really appreciate your time today.
And just so everybody knows, I wasn't nervous at all. Well, not nervous at all about this here.
You did great. I'm so proud of you.
I just feel like I don't even know what I just talked about. So I hope you guys enjoy it.
Just kind of blacked out for the last 30 minutes.
Absolutely. If you have any questions, again, I will include all that information. I have a really good little information on a slide that I made that I was supposed to follow that I didn't at all. But I think we got through a lot of good stuff.
Yeah, I think we did too. I'm really pleased with everything that we were able to get out to people. And I love knowing that there are providers like yourself and others that really have patients' best interests at heart and really want them to excel and use the variety of tools that we have available. And go get healthy and have some great sex.
Love it. Thank you so much.
You're welcome. All right, everybody. We'll catch you next time on Between the Sheets. Thank you for listening and spending time with me today. You can catch new episodes of Between the Sheets every Wednesday, because what better way to add some spice to your life than to have a new podcast on Hump Day? We will continue to explore common, uncommon, and taboo topics related to sexual health and wellness. Please send any comments, questions, or stories to podcastbetweenthesheets@gmail.com. That's all one word, podcastbetweenthesheets@gmail.com. Have a great day. And remember how important it is to discuss these topics with your friends, your family, and of course your partners. In fact, you can like, follow, and share this podcast so they can see it too. See you next time for more sexual health topics between the sheets.